And we are now joined by Dr. Rebekah Gee, former Secretary of the Louisiana Department of Health and now current CEO of Healthcare Services for LSU Health. Welcome, Dr. Gee.
It's wonderful to be here. Thanks for having me.
Dr. Gee, you helped to establish one of the first state-run perinatal quality collaboratives focusing on maternal mortality. Tell us more about why that was needed and what it means for women giving birth.
Sure. So unfortunately, in the United States, we have some of the worst outcomes in the developed world. So we set out to use data to inform our efforts to reduce maternal mortality. We found that most preventable deaths were because of hemorrhage that went improperly cared for. So you had women bleeding too long, you had women who were not given the right amounts of blood, you had not the right types of things at the time you needed them, all in one place, like a hemorrhage cart, didn't have training so that people knew how to work together as a team. And we fixed all of these things and we had remarkable outcomes.
What do you think are some of the most pressing reproductive health challenges that we face today?
Well, first and foremost, intractable rates of unintended pregnancy. Half of pregnancies are unintended. We're not doing a very good job there. We need to do better. We also need better contraceptives. We don't have great contraceptives for men. We haven't had a lot of progress since the 1970s with new mechanism for contraceptives, and we need to do better. That means both private and public sector investments, new ideas, bolder innovation. Number two is that we have some concerning politics in the United States around reproductive health. We have unprecedented levels of involvement of legislative bodies in the decisions between doctors and patients, particularly as they relate to pregnancy termination. And then I think finally, we have a sexually transmitted illness problem in this country. We still have babies born in this country with syphilis. That just shocked me when I got to Louisiana, that we had congenital syphilis in the 2020s. And that just needs to stop.
As Secretary of Health, you oversaw both the Office of the Department of Health as well as Medicaid. How did you align the often encountered silos between the two?
Public health ought to be the orchestra conductor for the healthcare symphony. Public health ideas, the public health data, the public health leaders have the holistic picture of what needs to happen and ought to be at the table for those decisions. And so public health needs to have a bigger seat at the table. If public health's not invited, public health needs to pull one up. And I think we ought to learn from what's happened with COVID. This COVID should be our public health wake-up call that we need to change.
You have served in numerous state and national policy roles. Do you think that there should be more clinicians trained in health policy?
I think it's really important to have people who are taking care of patients who actively understand what the healthcare system is like to be a part of it. In its brokenness and in all of its successes, I think informs public health. But also, I always tell people, don't become a doctor or nurse just because it looks impressive or you think it's a good idea. Do it because you like taking care of people. But for me, the caregiving, what I've learned from being a caregiver, merged with public health, both of those things powerfully inform how I do policy. And I do think that the merging of those two is the optimal perspective.
Dr. Gee, thanks so much for your time today. We really appreciate it.
Thank you. Thanks for having me.